Hi guys, Dr. Renato here with the Well Chiropractic. Today I want to talk to you or answer a question that a lot of people ask, and that is, does chiropractic treat blank? So whatever your condition may be, whether it's, let's start with something as extreme as cancer or diabetes or high blood pressure or irritable bowel syndrome, whatever it is that you're dealing with, I want to say that that's not a good question to ask. The better question to ask is, how do you want to be treated? Do you want to be treated in a way that we look at the body as specific individual parts, or do you want to be treated in a way where we look at the body as one whole, where we look at it holistically? So it just depends on how you want to be treated, because if you ask me if I treat any of those conditions I just mentioned, I don't. Right? I'm not licensed to treat any of those conditions, and chiropractic doesn't want me to even make that claim either. So, but if you're asking me, does the nervous system, does the body work as one unit? Absolutely, right? So if you want us to help you to fight off disease, to build good immunity, to have proper function, then yes, we treat everything, right? So what I do treat is vertebral subluxation, or subluxation for short. Basically, that's referring to the spinal bones going out of alignment, whether it's chemical, physical, or emotional. Stress, when that happens, is that we know that the premise is that there's a hard bone on a soft nerve causing some kind of a dysfunction or dis-ease in the body. So for example, I get people in the office here that have subluxation in this part of the spine, and they have neck pain or headaches or migraines, or sometimes they're dizzy, they're ringing the ears. Oftentimes this bone up here, the first bone, will contribute to things like anxiety, depression. Sometimes people get ringing in the ears. Whatever it may be, I find that once I work on that part of the spine, those symptoms go away. So again, we see the correlation that the nerves, they all control something. They go somewhere to have a specific message and a function. If you come to us with subluxations in this part of the spine here, we can be looking at sort of upper respiratory stuff like indigestion, heartburn, acid reflux, or even let's go further into heart and lungs. So if you look at this green line here, that's the vagus nerve, innervates pretty much everything in the body, and it's coming through this area here where the first bone in the body is. So if people have high blood pressure or high heart rate, I know I treated a patient that had a really fast heart rate. It didn't allow her to go to bed at night, couldn't sleep, couldn't work out because the heart was already beating really fast, as if she was working out. After a few visits, the heart rate came down. There's your randomized controlled trial right there, the clinical evidence. If you're somebody with asthma, right? Do I treat asthma? No, I don't. But I know that if I work on your mid-back, guess what? You're going to have less symptoms. People come to us and say, "Hey, doc, I don't need the inhaler as much. I'm breathing better." So we know that those nerves control that. Down in the low back, we're looking at digestive issues, whether you're dealing with irritable bowel, whether you're dealing with reproductive stuff, urinary tract, kidney function, if you're fatigued, if you don't have enough energy throughout the day. So again, the better question is, how do you want to be treated? It's not so much do we treat this, because I want to help you to fight the disease. I want to help you to build strong immunity so that your body doesn't have to go in disease state. And then if you are in that place, then you have to decide how you want to be treated. That's a better question to ask. So I hope you guys got some good tips and information from this. If you have any questions, just hit the link below, comment. I would love to engage in a conversation, and if I can't help, I'll find somebody that can. So thank you so much for watching.